multiple sclerosis. We're going to talk about pain now, and chronic pain is an annoying, debilitating and never-ending state of affairs for many people who are suffering from different conditions. According to the medical profession, it doesn't get due recognition, but the condition is being tackled by a multidisciplinary approach which is being operated by a number of pain clinics around the country. Mary Fanning visited the pain clinic at the Galway Regional Hospital.
There are no outward signs of chronic pain. You might limp a little or stoop, but overall, like these three patients, Aidan, Adrian and Caroline, you get on with your everyday life, boosted up by medication, but always suffering from annoying, lingering, never-ending pain. However, all that has improved dramatically since they, like many others, completed an 8-week course in pain management.
Mentally, it's taught us how to cope with it much better than we have, because a lot of us have been left alone for quite so many years, and we've tried to do the best ourselves, but we're not the experts. But on the programme we have a whole team of experts who know exactly what they're talking about and who have imparted their skills to us.
Post-accident, there's great medical and professional backup. Then you are on your own, suffering, wondering and developing all the comorbidities associated with chronic pain.
One of those comorbidities that would be a concern would be things like depression, also associated loss of appetite, loss of sleep and any alteration in mood. So therefore it represents a whole syndrome as opposed to a particular problem of pain itself, and therefore to address the pain issue we need to look at the overall patient and look at the other different comorbidities. And that's why it has been shown, and with a good level of support, that treatment in a multidisciplinary environment addressing each of these problems within that syndrome are important.
That multidisciplinary approach, drawing together a team which includes the services of a clinical psychologist, occupational and physiotherapy, nurse management and pain consultants, culminating in an 8-week course, worked for school teacher Michael Purcell.
I was able to kind of approach pain from a multidisciplinary approach, that it wasn't just having to suffer with the actual pain. It was about my mental approach to it, my attitude to pain, and also how I could overcome it. Now, I'm totally off any medication. I'm even reluctant to take paracetamol, just because it's on a principle now. And in October, I did the Galway Bay 10K and managed to do it in a respectable time.
Clinical psychologist Brian Maguire holds a session with Aidan, Adrian and Caroline. They've just finished their 8-week course.
Exactly. So Caroline, just wondering what you feel you've taken from the group and how it's been beneficial for you.
I've taken a lot from it. We've learned a lot about pacing and, like Adrian said, about not pushing your boundaries too much so that you end up being laid up for days. So I found it really helpful in that aspect to learn how to cope better with pain.
That's great. So I help people in pain management or with pain management by doing relaxation exercises, visualization exercises, cognitive behavioural therapy, which is a form of psychotherapy designed to help people to think about their pain in a different way, so that they don't think about pain as being limiting, so that they learn to understand that they can still do things despite the pain, and to try and help them to develop their self-efficacy or their belief that they can still do things even though they have this problem with pain.
Jennifer Banks, journalist and author, suffers from MS. During this session, she learns how to self-manage her pain. Her condition often sends her legs into complete spasm, and she must try to contain this until help arrives.
I'm actually a very passive person, but it's the one time that I feel so angry because the pain is so stressful. And I always found that the visualization techniques were too soft. I mean, I see the pain as these rabid animals, and I'd literally beat the living daylights out of them. And it works. It absolutely works.
Dr. David O'Gorman works away in theatre, managing more pain-related conditions.
So I think that there's no magic tablet, and I think that's clear, and there's no magic injection. And that's why the multidisciplinary treatment appears to be very effective. We have many developments from a scientific point of view and also advances in technology that have had major role in the treatment of chronic pain. But unless there's no magic fix, and unless the patient is stable within themselves and comfortable with their situation, then we can move forward.
A key element of the 8-week course is the physiotherapy sessions at Merlin Park Rehabilitation Centre. Joan Moynihan works with Adrian Kelly and Caroline Hode.
It does push people a little bit beyond their comfort zone, but again, there's that backup that if people do need help, they have it here. But the whole aim is really to give people that bit more confidence to work outside of a controlled environment setting, but they still have the backup in here when they need it.
Pain clinics are available all over Ireland. There aren't enough, and the waiting lists can run up to 3 years.
I fell off my horse when I was 15 and I fractured 3 vertebrae and broke my collarbone. The pain is constant, it's every day, and there's no escape from it. I found the physio very beneficial. You know, sometimes when you're in pain, you're afraid to exercise, you're afraid to push past the pain. But here we kind of learned how to do exercise that would kind of alleviate the pain.
The 8-week course in pain management has worked for all those involved, from a professional point of view and from a patient perspective. Now the patients are on their own again. So how do they keep that momentum and enthusiasm going?
Chronic Pain Ireland is a patient support group. We run self-management workshops. Now, these are very important because when people come off pain management programmes or they've been to pain clinics, or indeed if they haven't even managed to get to a pain clinic, we offer self-management workshops which help people to understand what it is to cope with chronic pain and use techniques such as relaxation techniques and other coping skills to try and live better with chronic pain.
Caroline Hode had her accident at 15 years of age. She had to wait until she was 22 to actually participate in the Chronic Pain Clinic programme. So what about the hundreds of others who want to join a course like this but are stacked in the never-ending waiting lists, synonymous with our medical service?
The Faculty of Pain Medicine recently from the College of Anaesthetists, we've approached the Department of Health and the Minister to talk about the recognition of pain as a specific disease as opposed to a symptom, and that hopefully will allow patient groups to be more aware of the condition and also look to maybe lobby their local representatives in their hospitals and see what treatments are available for them and how we can